Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water, or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 121,234 cases of COVID-19 in Canada and 40,367 cases in Ontario. Chatham-Kent has 336 cases and Sarnia-Lambton has reported 331 cases. Michigan now has 90,392 cases, with 13,117 cases being in Detroit. Today, we are reporting 2,414 cases of COVID-19 in our community, an increase of 4 cases. 3 are close contacts of confirmed cases and 1 is community acquired. 100 of our cases are currently active and are being followed by our health unit. 2,243 people have now recovered. 90 people are self-isolating and 5 people are in hospital. 26% of our cases are between the ages of 20 and 29 years, and 24% are between the ages of 30 and 39 years. 65% are male and 35% are female. Our community has lost 71 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. 3 retirement homes are currently experiencing a COVID outbreak. In addition, there are 5 workplace outbreaks, 4 in the agri-farm sector and 1 in the manufacturing sector. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain, if you're feeling confused or losing consciousness. Windsor-Essex has 2 COVID-19 assessment and testing centers, Erie Shores Healthcare in Leamington, and Windsor Regional Hospital, Olette Campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must remain isolated pending your test results. To check your results, please go to wechu.org and click View Your Results to access the online test result portal. If you are unable to view your results, please contact the assessment center or healthcare provider that initiated your test. The health unit will call you if you have been tested positive for COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, everyone, and thank you for joining us again. As we begin to prepare our school system to start educating our young minds, our children, there's a certain level of anxiety in everyone's mind. I understand as a parent myself. It doesn't matter what anyone say about the safety of my children, I would want to feel myself comfortable before I send my children back to school. As a parent, when you are considering many factors to send your kids to school, I would ask you to also consider these factors to help you make an informed decision about return to school. Number 1, being in school is good for children. It is good for learning, good for socialization, and good for the well-being of everyone in the family. Number 2, COVID cases in the community will continue until we find a good vaccine. Our goal is to minimize the risk to our children, contain outbreaks, and reduce the impact of the most severe outcomes. Number 3, you should think about the unique needs of the child you will send to school. Every child is different, and you need to look at your child's needs when you make a decision. Based on the available scientific literature, most children who have become ill with COVID-19, they have experienced mild illness and recovered without the need for medical help. A very small number of children get a severe inflammatory disease, but we do not yet understand what puts kids at risk for this. Consider any underlying medical conditions that you have or your own family medical history to assess the risk for your child. A conversation with your child's healthcare provider can help you determine those risks. If your child has any medical concern, return to in-person instructions right now may not be the best choice for them. For most children in our region, the benefits of going to school will outweigh the risk. Number 4, you should think about your own household. Who lives with your child at home? Anyone with chronic diseases like diabetes or those over the age of 70 will be at a high risk of developing complications associated with COVID. You should also think about an isolation plan in case anyone in your family need to self-isolate for any reason. Number 5, we will continue to focus on keeping the community safe and will continue to share all the relevant information to help guide your decisions. Number 6, most importantly, I want to emphasize that there is no risk-free option. Anytime there are more people coming in contact together, there is a risk, and all the efforts are directed to ensure that we reduce that risk and mitigate it as best as we can. We all need to work together, share responsibility, and keep everyone safe. I'll now switch to my weekly epidemiological summary. So very quickly, this is what we will cover. I've got lots of slides to cover, so I'll just give a brief overview on every slide. So this is the epidemic curve. We use this epidemic curve to assess the progression of disease, whether we are talking about in a community setting or in an outbreak setting. This particular epi curve shows the number of positive cases, COVID-19 cases, along with the date that they are presented with. As we can see, we have seen significant peaks and valleys in our epi curve. A couple of weeks ago, we have seen another sharp increase in the number of cases, which is evident in this graph, but now we are seeing a steady decline and coming back to something which is somewhat considered as a baseline for most of us. To compensate for the day-to-day variation, another way to look at it is the 3-day moving average. So this particular graph, epi curve, shows a 3-day moving average by its reported date. And as we can see clearly that the last couple of weeks, we have seen significant number of cases in our region, which started to go down, and now we are getting to somewhat which under the stable or baseline range of the cases. This particular graph gives us a breakdown of cases by agri-farm versus non-agri-farm cases. The majority of our recent cases have been from the agri-farm sector. We saw some cases in the community in the last couple of weeks, but now we're trending it back to somewhat which is a baseline, and also continue to see cases in the agri-farm sector. This particular graph looks at the cases that are presenting to our emergency department with some signs and symptoms of COVID. It's not a diagnosis, it's just based on the symptoms that they're presenting with. What we have noticed is beginning in March, April time, we have seen an increase to visits to the emergency department, which is comparable to the last year's data, and the line in green represent data from this year, and the line in blue is representing data from the previous year. So all these data are indication and acts as an early warning signs to us to identify a potential trend of what the community is experiencing. Focusing more on the Erie Shores Healthcare Department, where we have seen some fluctuations and an increase in the number of cases. What we are noticing is those cases that are presented to the emergency department is also going down, and that is also represented in the line in the green. This graph looks at two sets of data. The first is the number of tests completed each week, which is dark blue bar, and those tests, how many were positives for COVID, which is represented by orange yellow line. The second set looks at the unique number of individuals that were tested each week. We've got a number of questions many times about the number of people who are getting tested in our region, and questioning whether we are getting the appropriate number of testing done. This data presents in an easier form that on our baseline, we are easily touching up to 4,000 cases a week. And in some instances, we are going all the way up to more than 5,500 or close to 6,000 cases, 6,000 tests a week, which is a good, strong indicator of the testing that's been happening in the region. And based on those results, the number of positive that are coming back, what we assess is, what we can see in this graph, which is in the yellow and red, is talking about more on the positivity rates for these individuals. And we can see that the positivity rate is going down in our region. This particular graph looks at the 7-day moving average by reporting date, and this is what we do to look at overall trend. The blue line looks at all of our cases using a 7-day moving average. We see a peak in late March and April, and then in April it was attributed to the long-term care home. More recently, what we have seen is the sharp increase as a result of the agri-farm sector. And if we remove the agri-farm sector data, the data is represented by a 7-day moving average in the green graph, green line, and we can see that there was a increase in the community cases outside of the agri-farm sector, but then it started to trend down and coming back to somewhat which can be considered as a baseline number of cases in our region. This slide captures the week-over-week incidence rate for 100,000 population from week 18 to our current week. We saw a dramatic increase in the cases in week 26 and a second peak in week 30th, which are primarily attributed to the agri-farm sector. We're currently seeing a sharp decrease in our rates as of week 33. Please note that week 33 is still in progress and it ends on Sunday. So this graph basically gives us an indication of how quickly we are getting back the results. We have seen a number of variation. Most recently, the case that are positive are coming back to us fairly quickly, and it's a good indicator of how quickly the lab is working to give us the results back in our region. So from a public health side, this particular graph shows the cases investigated within 24 hours of reporting date. And despite all these large number of cases that our team has seen in the last week, all these cases are investigated within 24 hours of reporting date, which is a good indicator of how quickly public health is actioning any of these positive cases when it's reported to us. This looks at the regional and provincial rates of COVID-19, and Windsor-Essex County continues to have the highest regional and provincial rates in the province, way above than any other health units in the region. Most of these case counts are driven by the agri-farm sector, and Windsor-Essex is home to more than 8,000 to 10,000 agri-farm workers in our region. Looking at each of the municipality and looking at the rates, what we can see is the rate continues to be the highest in the municipality of Leamington and Kingsville, followed by Windsor, and the rest of the municipalities have a fairly low level of case activity in the rest of the region. This particular map shows the rate per 100,000 residents by dissemination areas, and the areas with no colors, that means that there haven't been any lab confirmed cases of COVID in that particular dissemination area. Please note that scale is used from 0.5 cases per 100,000 to 368.2 cases per 1,000, and the scale will change in each map and is a relative comparison to the cases in each geographical distribution. As you can tell from the previous slide, in Leamington and Kingsville, the darker colors, blue and purple, indicate higher cases activity in these specific dissemination areas relative to the county. Rates are low in the city of Windsor. Yellow or lighter version of yellow indicates low rates of COVID in these specific areas. Please note that this does not mean that these are the cases where infection happened, but rather these are the cases, these are the residential addresses of the cases where they live. Cases may have been exposed to COVID outside of their home or in another dissemination area, but this particular graph just focuses on where these individuals' home addresses are. Focusing on the city of Windsor, this is what the map looks like. Once again, the areas with no color are areas where there is no confirmed cases. This is again a comparison only in Windsor, and the scale ranges from 0.8 cases per 1,000 to 27 cases per 1,000 population. And certain pockets had higher rates across the city, but in general, those are the cases where the cases are living. Focusing on just the active cases, this is what it looks like in the county. Focusing on just the city of Windsor, this is what it looks like from in the city with the active cases using the same scale. This particular graph looks at the overall cases in Windsor-Essex by municipality, and overall what we can see is 36% of our cases from Leamington, followed by 24%, followed by 32% in Windsor and 24% in Kingsville. In the last 30 days, the picture continues to stay the same, with Leamington, Kingsville, and Windsor dominating most of the cases in the region, whereas the rest of the municipalities are showing minimal to no activity, such as in Tecumseh, which did not report any case in the last 30 days. Moving further, in the last 7 days, the picture continues to be the same. Kingsville, Leamington, Windsor continues to represent almost a quarter of each of these cases, while some regions such as Essex and Tecumseh did not report any case at all. From an occupation perspective, what we can see is roughly 37% of the cases are from the agri-farm sector, and 15% are from the healthcare worker. And there was a time when we started to see a decline in the case rates in healthcare worker, but we are seeing a slow increase in the healthcare workers, reminding them the need to follow all the measures that we've been put forward through public health measures. And we want to remind all the healthcare workers to continue to follow the guidelines, ensuring that the safety and well-being is critically important as we continue to work our way through this pandemic. So this is a new graph that we have added, and this is an epi curve by reported days for each of the municipality. This particular graph looks at the epi curve by reported date for the city of Windsor. It also shows the overall 7-day moving average, and with the red line, and the community average, which excludes any of the farm workers. So the farm workers are seen in this graph with the blue lines, and the community cases are seen with the green line, and the yellow line is showing a moving average, which is just exclusive to the community, while the red line indicates a combination of both, including community and farm cases. This is for Windsor. This particular graph is for Amherstburg. This is a graph for looking for Essex, using the same measures, including the overall 7-day moving average and then the community moving average. This particular graph looks at Kingsville, Leamington, Lakeshore, LaSalle, and Tecumseh. So we plan to post all these municipality breakdown of by epi curve on our website, and we intend to update it on a regular basis. All of these updates will be up on our website probably sometime next week, and our team is working to make it available on a daily basis. Looking at the age breakdown by municipality, this is what it looks like. We can see that some of the activities are we've seen in the previous week were coming from the younger age group, especially from the town of Amherstburg, and then some in Leamington. But majority of the cases we continue to see between the ages of 20 to 40 in most of these cases, which constitute most of the working people in the region. Overall, this is what it looks like from an age and sex distribution, and what we have seen in the last week. Again, we have seen some activity in the younger age group between 0 to 19 years age, where we can see it was 10% in the last 2 weeks compared to the overall, which was 4%. So again, recognizing the importance and need for younger people to follow all these public health guidelines and ensure that they are taking the appropriate precautions to keep themselves safe. This particular graph looks at the exposure history by reported date, and as we can see that in the last few weeks, travel-related cases are continuing to increase in our region, which again identifies the importance of anyone who's traveling to to Michigan, to crossing border for essential work, the importance of following all those public health measures to keep those travel-related case counts down. And also from a community transmission perspective, we continue to see some activity with respect to community transmission, but overall close contacts continue to dominate most of the cases, which is what we like to see, but we also like to see a low number of cases or no cases of community transmission happening, which is what we're all working on to achieve. This particular graph looks at the exposure history by reported date among agri-farm workers, and majority of these cases are a result of a close contact. We have seen some travel-related cases, and these are basically the new arrival of migrant farm workers who are coming to Canada, and at the time of testing, they are reported as positive and are represented as such, recognizing the importance of taking screening measures before they arrive, or the precaution that they need to follow when they are arriving in Canada to ensure that they are not passing it on to other people. This particular graph looks at the exposure history by reported date among non-agri-farm workers, and as we can see, majority of them are as a result of close contact, with very few people who are associating it with travel, and community transmission continues to be at the baseline, which is something that we'd like to see go down. Focusing just on the healthcare workers, almost 3/4 of our workers are local, whereas 22% of the healthcare workers that are positive in our region are workers who worked in Michigan. Looking at the underlying health condition, only 26% of the people reporting any chronic or underlying immunocompromised medical condition, and the majority are reporting no underlying health conditions at all. Fever, headache, cough continues to be the most common symptoms presenting with COVID, but please note that individual can present with more than one symptoms, and the numbers may not add up to 100%. Looking at the hospitalization and ICU capacity for COVID, we have seen that a steady decline in the hospitalization and ICU for COVID in the middle, but now we have seen we saw a spike in the middle of July with the admissions and the ICU utilization for COVID. It is also now trending downwards, which is a good sign for our community. As an overall health system capacity, what we can see is our acute care beds continues to hover around 85% of the hospital capacity, while when we are looking at the ICU bed occupied, which is close to 50%, is also something that we try to maintain. It's a good indication that if there's any surge in cases, and if people need ICU beds, they can be accommodated. So we are just barely passing that 50% mark for ICU beds, and the health system care system capacity will continue to dominate as we continue to work with our way in this pandemic. So in terms of where all these cases, all the cases in Windsor-Essex, 92.6% or roughly 93% of the cases are resolved, while 4% of these cases are currently self-isolating. Unfortunately, we lost roughly around 3% of our cases to COVID. Among those who died as a result of COVID, more females died in the region compared to men, and 68% of cases who died in our region are individuals who were 80 years or older. Overall, our case fatality rate continues to be significantly lower than the provincial average. Our overall Windsor-Essex rate is close to 2.9%, while the provincial average is at 6.9%. Overall, in Ontario, long-term care home case fatality rate was 21.2%, whereas in Windsor-Essex, it was 15.8%. Looking at the case doubling time, day-over-day comparison, so Windsor-Essex has seen some significant changes in the doubling time. Our doubling time is now coming closer to where the provincial average is. The most recent estimated mean R0 is 0.8. This has increased from last week when the R0 is less than 1, as we have mentioned. Every infection caused less than 1 new infection, signaling a decrease in the virus activity in the community. When the R naught is greater than 1, each existing infection is causing more than one new infection, and our R naught estimate varied considerably due to the influx of cases from the agri-farm cases. But the recent days, we have seen a decrease in cases all over Windsor-Essex. Please note that these R naught is a function of all the measures that are currently in place, and is not a true R naught when there is no intervention in place. So in summary, Windsor-Essex continues to see a general decline in cases in the past week. The primary source of exposure continues to be a close contact with a confirmed case, which is good for public health. We like to see that. We like to see a reduction in the community transmission. COVID-19 related hospitalization are starting to decrease again, which is, again, it's a good indicator from as a health system capacity perspective. And day-over-day doubling time in Windsor-Essex is coming close to on par with the province and for Canada. And the effective R naught value is 0.8, indicating a decrease in transmission, but it has increased slightly from the last week. So before I take question, I would like to add one important message to our viewer as well. As part of public health case and contact management, our team contact everyone who's identified as a close contact. All high-risk close contacts will be advised to self-isolate for 14 days. Failure to comply with that order is an offense under the Health Promotion and Protection Act, to which individuals may be liable upon conviction to a maximum fine of not more than $5,000 for every day or part of each day on which the offense occurs or continues. I came across with a few instances where individuals are asking who named them as high-risk contacts and were reluctant to follow the advice of public health. Under privacy law, we cannot share the name of the confirmed case, but we will reach out to all the high-risk close contacts directly and will advise them to self-isolate. I expect our community to follow the recommendations and avoid getting an order issued under the name, under the Health Promotion and Protection Act. Thank you.
The conference is now unmuted.
We'll now take questions from the media. Any questions from CTV?
Yes. Good morning, Dr. Ahmed. Well, yeah, let's go back to what you were just saying. So in that instance where close contact declined, what do you do?
Well, as I mentioned, we try to educate them. We try to help them understand the importance of self-isolation. And if they are still reluctant or not complying with our recommendations, an order is issued, and we have issued a number of orders throughout this pandemic. And now, as we are recognizing that more people are asking who named them as their contact or who identified them. Obviously, we cannot share all that information under the privacy law, but they should trust on our investigation and follow the recommendations. I absolutely don't want to issue an order unless it's necessary. It is necessary in most cases, especially if it's if there's any risk to the community. So I would request that people follow those recommendations and follow the advice of public health to keep themselves safe and keep our community safe.
So after the recommendation, if the person walks away from, whoever they're talking to and decides, well, yeah, forget that, I'm not going to bother. Is it one of those things where you follow up and then, maybe throw an order on them?
Yes, so we follow up with them over the phone. We send our health inspectors or our tobacco and vaping enforcement officer. At times, we take the help of our local police as well, and to get them voluntary compliance. And if they fail to do that, that's the time when we issue the order.
But you haven't gotten to that point yet.
We have gone to that point of issuing order to a number of individuals, but again, as I said, we don't want to be in that position. We want voluntary compliance. We want them to follow the recommendations.
Okay, thanks for that. No, I was just picking up off what you said, but the one question I had for today was a question from the community where they're wondering why, the whole education and back to school, because obviously that's a hot topic. Why aren't high schools going to one class a day model like they're doing for summer school sessions? Or is that being talked about?
Well, I think some of these are operational decisions that the school boards are making. The recommendations under the under our guidance and under the ministry is to minimize the class cohort size and ensure that they are given number of options, and depending on the class sizes and the availability of teachers, I'm sure that some of these guidance is coming directly based on the operational needs.
Okay, so is that something you would recommend at some point? Is that a thought? Has that come across your table?
Well, I think we are having a number of conversation. I cannot speak specific to that's something that we are recommending. Obviously, we are highlighting and helping the school boards follow any of these recommendations that is based on public health science and public health evidence. We're not the one to approve their plan. We are there for them as a resource, to consult them and provide our recommendations. As an overall, my responsibility is as a medical officer of health. If I do feel that there is a risk to the community, we can be more strict in what we are recommending. But at this time, we are working closely with the school board to look at all the options to make sure that their plan takes into consideration all the possibilities and are utilizing all the resources that are available, are utilizing everything that they have in their toolbox to keep their students safe.
Okay, great. Thank you, Doctor.
Any questions from Windsorite?
Good morning. You just mentioned that there were some individuals who you issued an order to. Do those orders contain a fine, or is it just an order?
Well, the order is an order, and failure to comply with this order can result in fine. That's what we are sharing, and we are reminding residents that it's not just someone telling you to do it, and it's your choice. Unfortunately, it's not your choice when it comes to the public safety. And under the Health Promotion and Protection Act, we do have that authority. We don't want to use that authority. We want everyone to comply with our recommendations and follow the recommendations in the best interest of the community. But we do have that flexibility to issue an order to get compliance.
So have any of those orders actually gotten to the point where they became fines?
Not at this point, and we certainly don't want it to go to that point. We want our community to follow, just like we've been doing it for the last 6-7 months now. So it's just a reminder, as more and more people are now going to work and they feel that they need to be at work and they don't want to self-isolate. There are a number of options for all these people through their workplaces, through being identified as close contacts. I think they do have that obligations to the community and to keep your community and keeping your community safe.
And last one, how many people total have had an order issued against them?
I don't have that number, but I can say around 10 would be a reasonable number that I can remember.
Okay, thank you.
Any questions from CBC?
Yes. Good morning, Dr. Ahmed.
Good morning.
So 6 really important recommendations that you gave today for parents considering, what they're going to do with their kids in back to school. But we also live in a region that has one of the highest rates of poverty for kids across the country. And a lot of parents don't necessarily have the option when it comes to the decision of the economic stability of their family and sending their kids back if those parents have to go to work. What would you say to the parents of kids that feel that their hands are tied because, they can't have their kids staying home alone all day?
Yeah, no, we definitely understand that. We definitely recognize that not everyone have that option. That's why it is important that we make that decision based on what is best for our children, my children, and everyone's children. And it has to be individual decisions that each parent has to make. There is no one formula. There is no one particular issue that everyone is concerned about. Everyone has got different issues. Everyone has different questions. So it is up to each parents to feel comfortable with what their questions are and have them answered. As I mentioned, there is no risk-free option. Every time there are more people coming together, there is a risk. what we are trying to do, what the school boards are trying to do, what everyone is trying to do to mitigate all those risks, try to prevent many of these risks. And as much as we are all in this together, we have to recognize the risks and the benefits of children being in school. It's always a fine balance. Every decision that we are making in public health, none of these decisions are risk-free. None of these decisions will make everyone 100% comfortable. It cannot. That's just the reality of it. So what we need to do is how much risk we are willing to tolerate, how much risk we can accept, and knowing that what are the risk mitigation measures that are in place. As much as it's important for the children to be in school, it is also important for each parents to look at their individual circumstances, their own situation. And many of these recommendations touches on that. You have to look into your own situation. You have to make a recommendation based on how your child is, whether they are good in following the instructions, whether they are not good in following instructions, what they do with their other classmates, how they behave. So all these recommendations, all these determination has to be coming on an individual basis. But all I can tell you is we are really trying to work with all our partners, including our school boards. School boards are really trying hard to make sure that they have a good plan in place. And that's all we can do. COVID is not going anywhere until we get a vaccine. So we have to make that determination is what is best for me, my children, and as an entire community. So all these recommendations should help everyone to make that decision.
Thank you, Dr. Ahmed.
Any questions from AM 800?
Dr. Ahmed, when it comes to education, I'm not sure if this question has been asked to you, but over the last couple of weeks, but when it comes to the elementary level, do you support the 30 or less students in a classroom? I guess a yes or no, do you support 30 in a classroom for elementary?
Well, I guess it's a tough question for me to answer because it really is dependent on the number of, the size of the classroom. If the classroom is big enough to accommodate 30 people with maintaining 2 meters physical distancing, yes. Because again, I'm not an educator myself. When it goes back to the actual education piece, that's the determination that the school board have to make, whether 30 kids per how many teachers, it's their expertise. What I can tell from the public health science perspective is that they have to be physically distanced. They have to wear the mask. They have to have all these measures in place. Good screening and prevention program, because when we're talking about a child in the school who is sick, it's already too late. We have broken many of the other important tools of prevention before the child enter the classroom. So all of these measures are important, critically important, before a child end up in a school system. So doing a screening on your child, ensuring that if your child is sick, or even as a staff or a teacher, they're going to school, they need to do those screening and ensure that they're not putting anyone at risk. So by the time when they're coming in, again, all of these risks are trying to mitigate. But in terms of the actual class size, I think that's up to the educator themselves, what works best from an education perspective, from a health perspective. If all these children are appropriately spaced, I think that would follow the public health guidance that we've been providing for some time now.
And then switching gears, the Premier obviously was in town yesterday, and Taylor asked Teresa if yourself or members of your team would be talking to the Premier. The answer was no. The Premier has come to Windsor-Essex 2 times. Both times he has not met with you and your team. I know you don't want to make this political, but if we're considered a hotbed for the virus, wouldn't you think it would be important for him to reach out to you or your team? And correct me if I'm wrong, have you had a one-on-one conversation with him since the pandemic started?
With the Premier, no, but I have been in contact with the Deputy Minister directly. Both myself and Teresa, we've been in contact with the Chief Medical Officer of Health on our almost like I would say more recently on a daily basis. With the Office of the Chief Medical Officer of Health, Associate Chief Medical Officer of Health, and the Emergency Operations Center at the Ministry. So we've got a lot of connection and resources that we are getting from our colleagues who are the experts in public health side. So I feel much more comfortable having that contact directly, recognizing that again, it's the Premier is representing the people and not necessarily invested or that much. I shouldn't use the word invested. My apologies. Not necessarily have the technical know-how or expertise in everything that we are doing. Obviously, overall, he's trying to look at the bigger picture, that how the people are concerned, what are their concerns, and how he would address those concerns. So I think he's connecting with the politicians, which is great because our region has unique challenges, and many of these challenges are about the people. And if that is communicated appropriately with our politicians up to the Premier, I think as a resident of Windsor-Essex, that's what I care about. What from a public health side, I care more about having that availability to the resources, the public health resources that is available through the ministry, which we are getting, and having those direct contact with these offices. I think it's definitely helping us a lot.
Okay, thank you.
Any questions from Blackburn?
Yes, I wanted to ask Dr. Ahmed, mentioning the people who have been ordered, being around 10. Why are you bringing that up now? Has there been an increase? Have these 10 cases been recent, or have they been kind of dispersed throughout the pandemic?
Well, the 10 has been dispersed around the pandemic, but I think what we are noticing is more people questioning and asking that who identified them and do they have to self-isolate, recognizing that many of them have some economic concerns as well. And, as they were waiting for all this pandemic to get over, now when they're going back to work and then now they're being asked by public health to stay home as being identified as a close contact. So I think there is this disconnect that people are not really appreciating that why they're being asked of. What we can say is we're getting more of these questions now. And again, I don't want our staff to be in a position or anyone in a position where we want to use the authority. So we want to make sure that it's a good reminder for people to know that this is important. This is not a choice. This is not voluntary that they have to self-isolate. It is about the risk and public safety. And if needed, we have the tool to issue an order, but we definitely don't want to get to the point of issuing that order. That's why we wanted to educate everyone on that.
And also, I guess, do you have a message for employers, perhaps? I know that I do believe it is against the law to fire an employee for self-isolating, but realistically, some employers are going to pressure their employees. So do you have a message for them?
No, absolutely. I think it is important for the employer as well to be aware of all these nuances as more and more businesses will open up in stage 3. There will be many situations like this because we know that COVID is not going anywhere. Many of the employers haven't had this experience before, but when they are being told that one of their employee has to self-isolate for whatever reason, they have to understand that it's based on the recommendations of public health. And as the person themselves is as an employee, they must notify this to their employer that this is what it's coming down from public health, that they have been advised to do that. And I think those communication need to happen very clearly and with trust, with respect, and with confidentiality. And I don't want any of the employers to penalize their workers if they are asked by public health to self-isolate.
Thank you very much.
Any questions from Windsor Star?
Just one this morning. Most of mine have been covered already. Good morning, Dr. Ahmed. Are the new charts that you presented today a direct response to requests from municipalities for more municipality-specific data?
Partly yes, and as I mentioned that last time, Taylor, to you, is we are obviously, we have limited resources that we are using. And every time that there is an opportunity for us to streamline some of that work, to present more data, to present more information, which is not jeopardizing any privacy laws, and which is also not giving a wrong public health message to everyone else. I think we are always interested to do that. And our health unit has been more transparent than what people are thinking. And I just want to make sure that people know if this data is of importance to you for your decision making, we'll be there. We will share that information. But many of the requests, many of the information that people are thinking that they should get, it's basically it's inappropriate, and people are thinking that they should probably know everyone who is positive in the entire region. They will never get that. Doesn't matter if it's a politician, doesn't matter if it's anyone else. They will not get that level of detail under the privacy law. And as the custodian, health information custodian for the region, we take this responsibility very seriously. Personal health information is very critical. We will not share any of the personal health information unless there is a public health risk, which we have done, and which will take that responsibility very seriously. We will share the rest of the information as much as possible to help individuals, help people, help residents of our Windsor-Essex to be more informed. But many of this information that people think that they have a right to know, unfortunately, no, they don't have the right to know. And it is something that we have been sharing, and we will continue to share the information which we can under the privacy law, and which will help our community in understanding what is happening in the region without giving them any false sense of security or even painting any false sense of a picture that one neighborhood or one particular region is bad or worse than the other. COVID is everywhere. People can contract COVID everywhere. We have to take our responsibility and I've said this many times and I'll say it again. If I am out there, wherever I am, whether it's my workplace, whether it's my community, whether it's my family, whether it's playground, anywhere, it is my responsibility to take precautions. No one else will do that. Even if someone is 10 people around me who are in close proximity, and if all of them are telling me, yeah, they're tested negative, still, it is my responsibility that I have to take precautions, because I would never know who will be positive, who is telling me the right information or not. It doesn't matter. It is up to me. I should take responsibility instead of blaming it or expecting others to share that responsibility to you. As much as it's a concern, as much as it's causing anxiety among many people, some of this responsibility, it is on everyone. It is on you, it is on me, it's on everyone, and we have to accept that responsibility and take appropriate precaution.
Have you had any municipal officials request information from you that would breach privacy, like a specific address of all the positive cases or things like that?
I would rather not answer that question.
Okay, understandable. I can recognize that just people in the general public might ask for that, but I respect your decision.
Okay, thank you.
Any further questions from CTV?
Of course. So, Doctor, I'm just thinking, okay, God forbid you, I, or anybody has enemies, but I'm thinking, like, I understand we won't share understand the privacy, we won't share the names of people who are naming others as contacts, but if somebody has a personal vendetta, they could just say, you're a close contact. So could you please clarify, just for everybody in the audience, please clarify what is classified as a close contact, just so that we have the boundaries so that, we never get implicated falsely.
Yeah, no, that's a good question, Bob. And if I may use you as an example and Rob as an example, to say that, let's say if one of you is identified as a case, let's say, and then obviously we would want to know, okay, who you work closely with or where do you work? And then based on that, we like to say, okay, while you are working in the last 48 hours, where you can potentially be considered as infectious, who you came in contact with, who was in the workplace, who you worked in the same room, shared the same breathing space without having any personal protective equipment. And then we collect all that information. And then when we are getting to, let's say, if one of you name each other, and then when we are connecting with that person, we're asking the same question. We're asking, okay, who did you work with, what kind of environment it is, and then what we're trying to do is we're trying to link those two information together and to get more clarity that yes, this is the right people that we're talking about. We're not missing anyone else, because it's possible that you may not identify everyone, or maybe Rob may not identify everyone else that he has come in contact with, but collating those two information together, we'll have a better picture. We will know who can be a close contact. And then based on that, we will then make that recommendation to ensure that who needs to self-isolate, who does not need to self-isolate. So it's not just because you're naming someone, that person is automatically will be identified as someone that that needs to self-isolate. So I think we do need that part. We do want to investigate that. And for the workplaces, that's what we are asking. Majority of these workplaces, you should have good information available. Who's at work, who is not at work, and who attended that meeting, who was with someone together. So in case when we are talking about maybe a person who attended a meeting with 5-10 different people, there has to be some kind of record keeping that we can identify these 10 people, these 5 people work together. And if any of them at that time was infectious, we have a list. So I think it's working closely with the employer, it's working closely with individuals who is positive, and it's also working closely with the contacts, bringing all that information together and then help make a decision. So we're not just taking names and then just putting potentially, everyone in isolation just because someone named them, and using any personal vendetta for that.
Okay, good to know. So Rob and I can breathe okay today then.
Well, yeah, it's up to entirely both of you. Rob has to agree to that.
Yeah, of course. All right, doctor, have a good weekend. Thank you.
Any further questions from Windsorite?
I'm okay, thanks.
CBC?
All good. Thank you so much.
AM 800?
I'm good, thank you.
Blackburn?
I'm good. Have a good weekend.
And Windsor Star?
All good. Thanks so much.
Take care,
Thank you.
everyone.
Thank you.